This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Thanks to PM&R Scholars for giving us the opportunity just to chat about our program, and congrats to all you guys choosing to go into a great field. I think the world needs more good physiatrists, and hopefully I can give you some more information about our program and hopefully help you to get there. So this is just a opening slide here. This is just our whole program. This is our class photo from last year. We graduated our first class. We can talk a little bit about their outcomes towards the end of the presentation. And I'll try to speed through this pretty quick in like 10 or 15 minutes just to open it up for any questions if anyone has at the end. You can just pop them in the chat and I'll kind of answer them at the end as quick as I can, time permitting. So here we have just the entrance to our facility. So again, we're a 111 bed standalone rehab hospital. We do have the acute care hospital about a 10-minute drive away, which is super convenient. 4-year program. So my year was actually the first categorical program. You'll do your entire intern year over at the main hospital, and then you'll transition over to the rehab for your second, third, and fourth years. This is just a kind of a photo of the main hospital. Fun fact, Taylor Swift was born here. She's originally from Reading. We are a level 1 trauma center, which I think is really important for PM&R just because you do get a lot of the high-end TBI and spinal cord injury patients, see a lot of amputation as well. We have a very good relationship with the trauma service. So anyone that comes in, they're automatically consulting PM&R for anything that's PM&R relevant in terms of spinal cord injury, brain injury, amputation, etc. Yep, your pain rotation, everything will also be over at the main hospital. So you can see at the bottom, we have procedure suites over at the main hospital. You'll work with the pain department. We do have a helicopter pad, and we like to tell people that sometimes as an intern, you will get to go up there and be part of the trauma team, and you're doing those initial trauma assessments. So just kind of a unique experience here, I think. And this here is just our general PGY1 intern year experience. So just some of the rotations that you'll be doing. Again, it's very PM&R relevant, I think. All this will be done over at the main hospital. There's 1 or 2 clinics that you'll rotate at for orthopedic surgery. I think is going to be mostly outpatient, but it's like a block or 2 up from the hospital. Same thing with neurosurgery. And from my experience, I think being an intern here and then transitioning into your PM&R years was kind of a cool experience in the sense that you're seeing patients your intern year that you'll eventually get to see during your PM&R years, and you'll kind of get to follow them through the process. So bit of a unique experience. One of the new things we are adding into this year's rotation is just the neurocritical care. So just to get our residents a little bit more ICU time. That was kind of a lot of the feedback we got from previous classes, and that's something we wanted incorporated. So we were able to get that done. Just to highlight at the bottom, so there's no overnight call, there's no home call on any service during your intern year. I think internal medicine, I want to say you're only working a weekend if you're originally scheduled that. And I want to say you do like 1 or 2 weeks of like night call total the entire intern year. I like to kind of tell people the intern year here is you're going to bend, but you're not going to break. You're going to need to learn. You're going to learn everything that you need to be a good physiatrist. And it won't be as stressful as I think as it needs to be. I'm sorry, it won't be too stressful. It'll stress you just enough. Other rotations that are not listed here. So palliative medicine, that's another big one. I think that's really important, kind of teaching you how to run team conferences, be the leader of an interdisciplinary team. So another big rotation, just not included there. And these are your rotations that you'll have from a PGY 2 through 4. So again, everything's kind of, it's in-house. So everything is done at the rehab hospital. So outside of pediatrics, which is done at Good Shepherd, about, I want to say it's 30 or 45 minutes away. I'll do that as a 4, just 2 months. Everything else is done at the rehab hospital, except for the peds rotation and then your pain management rotation. That'll be done over at the main hospital. So again, that's about a 10-minute drive from the acute care hospital. And you can see here we are a little bit heavy on the inpatient side as a 2, not as heavy as most programs are. You do get 4 months of outpatient as a PGY2, and then from then on, you only get more outpatient and less inpatient. A lot of procedural rotations here too, so you can kind of see. So as a 4, you'll do 3 months of EMG. You'll get another 2 months of an EMG as a 3. And then you'll actually start doing more hands-on procedural stuff right when you're a PGY2 in those 4 months of outpatient. And we can chat more about procedures and hitting numbers and things like that in one of the later slides I have. But your core inpatient rotations, you have amputation, spinal cord injury, stroke, trauma/CM, which is complex med. And then you'll do TBI as a 3rd year. So. Oh, and then the other thing is inpatient consult. So that's also done at the main hospital. Forgot to mention that. So just PM&R our call schedule. So we just recently changed this. So there's no in-house call or overnight call. Again, as an intern, as a PGY 2 and 3, you will take call. So call, we have a new schedule we're using this year, a new schedule that we're using this year. You can see it here. So there's basically one resident on call from Monday, 7 p.m. to Friday, 7 a.m. Again, it's home call. You don't have to come in person for that. And then there's a weekend resident. So you'll work the Saturday and the Sunday. You'll be in-house, which is normal. But then that same resident will work Friday night, Saturday night, and then cover Sunday night into Monday night. And then kind of a nice reward for that is the resident that was in-house on the weekend gets a half day on Monday. So if you're working an inpatient rotation, you're basically coming in, you're working, you're rounding on your patients, you're writing your progress notes, you don't do any admissions, any discharges or anything like that. The attending will handle all that, and you get to go home for the day. So PGY 2s and 3s will take calls and cover the weekends. We have it structured right now where the 4s don't do anything. It is slightly tiered. So it comes out, I want to say the math comes out to about 8 weekends for PGY 2, and then the PGY 3s take about 5. So it gets a little bit less as you go on. And then it's nice as a 4 that you have more time to do any kind of moonlighting. If you wanted to, do research or pursue other hobbies or things like that, or even look for jobs, you have that time kind of built in, and it's affordable as a 4. This is just a picture of just kind of our gym, one of our main gyms. So there's a gym on every basically floor. Rehab hospitals, 2 floors. You can kind of see here, we've got the 0G system built in around there. I don't think we have a picture of our exoskeleton here. It's in one of our upcoming slides. We have a nice view kind of right back outside the gym. And again, just how we're broken down. So 56 beds is what our the acute rehab side covers. Those beds are all covered by residents and attending physiatrists. We do have a transitional subacute care unit upstairs, so that's primarily run by the hospitalists. But something I did want to highlight with that is, while we're not the primary team up there, we are consulted up there. And that's actually something we're uniquely kind of building into the PGY 3 and 4 rotation. And that kind of gives us a little bit more of an opportunity to just hit procedure numbers. I don't think anyone's had trouble hitting those numbers, but again, I know that a lot of people out there are interested in going into the interventional stuff, pain, sports, spine, things like that. So we regularly get consulted up there to do ultrasound guided injections. And sometimes we even do Botox as an inpatient. I think that's everything there. And then the other thing to highlight just about the TBI unit, it is a locked unit. We have a TBI boarded attending. We have a spinal cord injury boarded attending. We basically have attendings boarded in every subspecialty. So you'll get a very unique and kind of diverse experience there for PM&R. Again, TSU, so 50 beds upstairs, hospitalist run. We kind of just cover up there for procedures. Other thing I wanted to highlight about the acute care unit is that you do have a hospitalist co-consulted with you for everything. So you're the primary team, you have an on-site hospitalist. I think that's very unique to what we have here. So, you're expected to manage all the medical things. So you're touching the blood pressure meds and you're managing the insulin and things like that, but you do have that backup in case you need it. So I think it makes for a great learning environment, and especially for anyone interested in running an inpatient service, I think you're going to get a great experience doing that. We also have kind of the subspecialists come here. So we have pulmonary, neurosurgery, orthopedics. They all come on site to see their patients. We do x-rays on site. The way it basically works with like the night call, for example, if you have a patient you think is, they're a little bit more medically acute than someone else, and you need to send them for a CT scan or an MRI, you can send them over to the main hospital. It's a quick 10 minutes ambulance ride. So we do have all those kind of, while we are a standalone rehab facility, we have those unique features as to basically being connected to the hospital. So outpatient clinic stuff, we can talk about that real quick. You can see Dr. Sam here working with one of our old chief residents, just guiding him on some ultrasound. Dr. Sam's huge on ultrasound, so is Dr. Brockman. They've done the STEP certificates for ultrasound and I believe spasticity as well. So they run like 7:30 a.m. ultrasound sessions when you're on your outpatient rotation, just to get that extra hands-on experience using ultrasound. You can see here just kind of our EMG numbers. We're really big on EMGs here. You will not have any problem hitting those numbers or any of your procedure numbers. I was actually chatting with one of my fellow PGY3s this morning, and so we're brand new PGY3s and just kind of looking at our procedural numbers. And in terms of Botox injections and joint injections, I think we both only have like another 2 or 3 left in each category, and then we're done. And that's start of PGY3 before we even get to those really kind of procedure heavy rotations. And in terms of EMGs, I think we were both kind of in like the 50 to 70 range. So again, you're going to get a lot of hands-on experience here, and you're going to get it pretty early on in your training, which is something I think is a little bit unique for our program. Cancer rehab, Dr. Brockman here is huge on cancer rehab. He's kind of working to grow that program here. Every Wednesday morning, he'll sit in on the interdisciplinary cancer rounds with the, hematology, oncology, radiation oncology, and kind of rehab will give their input on that. And it's kind of a unique way to get patients plugged in early as to what physiatry can offer these patients. So I think it's a very neglected field of PM&R that's slowly growing, and rightfully so. And we're trying to do our part here with that. We do have a special spine clinic here. So with that, we obviously do a lot of EMGs, a lot of procedural stuff. And again, a lot of these patients, you'll see them in the physiatry clinic, but then you'll also see them again in your pain clinic. And then as well as on our outpatient side, we actually see a ton of amputee patients. We see a ton of spinal cord injury as an outpatient stuff. We do baclofen pump refills. We have a wheelchair clinic. And we have Hanger as our local prosthetist, and they come here on site, and with all of our amputee patients and Dr. May, they're on site and kind of helping us get what we need done and teaching us the right way to kind of write what we need to put in our notes to make sure we get the patients the things that they need. So Good Shepherd Pediatrics, again, it's like 30 or 45 minutes away up in Allentown. I've yet to do this rotation, but my seniors that have done this rotation have said it's an amazing experience. You'll work with PM&R pediatric boarded physiatrists, 20-bed inpatient unit. There's also some outpatient exposure there as well. Dr. Liu, one of our outpatient physiatrists here, actually specifically does Botox for pediatric patients at the local surgery center. So that's something you'll get to do on your outpatient rotation as well, if that's something that you're interested in. And this is, so Drexel University is kind of, so we're a community hospital. We kind of have we're more or less semi-academic. We do have this affiliation with Drexel. We get their med students all the time, which for anyone interested in being an academic physiatrist, I think that's huge. It gives you the options to teach with med students. It gives you the option to work with med students. There's certain lectures built in that PGY2 and PGY3 residents will give to the med students, just standard stuff that we give them.
I don't think we do.
That's
I don't think we do.
That's again for those interested in more of the academic component of physiatry. And that they have a brand new campus. It's only a couple years old. It's about 5, maybe 10 minutes away from the main hospital. So we're in the process of getting our cadaver lab set up from there. You can kind of see that in the bottom picture. But as a resident, you do have access to the facility. It's full time, and you can basically use it for whatever you need. Just some of our benefits, all this stuff's available on the website, so I'm not really going to go through it. But I will say, as a resident living here, I think the salary is great. You're not living paycheck to paycheck, and I feel pretty comfortable. Cost of living here is fairly reasonable, I think. Just some of our kind of the unique experiences here. So street medicine is something that we've been working on. That's through the internal medicine program. So you're working just with the local kind of underserved population. So you're actually going out and seeing homeless people and things like that, and kind of helping them and working on some musculoskeletal things. Dr. Brockman's actually in the process of setting up his own free medical clinic at one of the local shelters. So it's an aspect of our program that we are looking to grow. One of the other things I'll highlight is just this produce pickup at the bottom. A lot of residents do it. There's a lot of farms here, so you're getting fresh food, fresh meat, and it's fairly well priced. So something kind of unique to the area that I think we're taking advantage of. Research support. So here's Annika, one of our recent graduates, just presenting at Tower Research Day. Again, we do have research mentorship here. We have that through Drexel, 24/7 librarian access. some of the research we've currently had. So we have residents that have published peer-reviewed original research, mostly on EMG. We have a couple other projects we're looking to get off the ground here. Usually every year we have somebody presenting at either AAP or AAPM&R. We also have, for those of you out there interested in pain, so we have pretty frequently have people at ASRA or the PA Pain Society, which is one of the local conferences that people present at. The current ASRA president is actually a graduate of our program. He's doing his ACGME pain fellowship in New York right now. So research-wise, we've got a ton of that going on, and obviously residents have QI projects as well. And we do have our own biostatistician, so that's been huge as well. Resident wellness, so you can see here some of the photos. So bottom left, we had a laser tag event. That was during my PGY2 year. Bottom right, we had a top golf event. And then the top right picture is actually just a happy hour we did after a rotation. Our next one coming up, we're going to Hershey Park at the end of the month. So I think everyone's looking forward to that. For anyone on an inpatient rotation, you're basically coming in, you're rounding on your patients with the attending, you're not writing any notes. And then from 10 o'clock until the end of the day, we're off to Hershey Park. So I don't think anyone here feels too burnt out. They do a pretty good job of supporting us here, I think, both professionally as well as wellness and things like that. So it's a good work-life balance here, and I don't think you'll find that anyone feels entirely overworked. I think the senior residents do a great job of helping out the younger residents in case they feel overwhelmed. That's that. And then again, so we are a newer program. So just a heads up as to where our recent graduates have gone. So again, one ACGME Pain Fellowship in New York, another one is doing a sports medicine fellowship in Delaware, and then we have a third guy who's doing an interventional sports and spine fellowship down in Florida. Our fourth graduates just wanted to go right into private practice. So again, everyone matched pretty well. Those were their first choice fellowship options. They all got to where they wanted to go. I think one of the things that's a little bit unique about our program is that, I kind of always like to look at physiatry as, what can I put in my toolbox as a resident? Here, you're going to kind of learn a little bit of everything. And if there's something that you're particularly interested in, it really we give you the opportunity to kind of delve into that a little bit more. So if you're looking to go the procedural aspect, we have that stuff here. If you're looking to just be a general inpatient physiatrist, as well as having like some outpatient MSK stuff, I think you'll be very well prepared with all of that here. And we can really do a good job of tailoring what you want to do with your career with our curriculum in terms of electives and things like that. And then real quick, just with the electives, so you are allowed to we have in-network electives, which you can obviously do at any time. But then you're allowed to do out-of-network rotations as well, or out-of-state rotations, and things like that. So living in Berks. So again, some pictures here that we have. So the two pictures on the bottom left is kind of Penn Ave. It's like our main Ave. So they regularly have fairs there. I think like the first Friday of every month, there's some kind of like a block party. Good restaurants, good bars. Philly's about an hour away. Lancaster, which is another kind of popular, close by city. Lots of restaurants there as well. So residents are regularly making those runs. We have minor league teams locally, but again, all your professional teams in Philly, like the Flyers, Eagles, Phillies, about an hour away. I think the program's actually paying for us to go to a Phillies game I think in the next month or two. So that's something we're all looking forward to. And honestly, the minor league hockey, the Reading Royals, has been a great experience. For those of you interested in sports medicine, you're allowed to shadow the physicians with them, and you'll be right there, ice level with them on the bench. So I'm not interested in sports medicine, but I'm going to a couple of the games just as like a local fan. I'm actually considering just kind of shadowing with them just because you get to sit there right on ice level, and it seems to be a great experience. So, and you have skiing and stuff as well. Blue Marsh Lake is very close by, great hiking, tons of paddle boarding, things like that. And again, just kind of what I talked about. The other thing that's nice is, so New York is about a 2.5 hour ride away. And then if you want to go to any other major cities, DC is fairly close by as well. So again, you're not going to be working a ton of weekends as a PGY2 or PGY3 or even as an intern. So if you did want to make those weekend trips, those options are there, and they're available to you if that's something you're interested in. And then just some quick photos to kind of close it out. So top left, just That's during one of our OSCEs last year that we had with some of the residents. So that room, I know you can't see in this picture, but we have a brand new learning center that we're running that we're actually going to start using tomorrow for didactics. So we'll have our weekly didactics in there. Bottom left, it's myself and a couple of our graduate residents, our 2 former chiefs, with our program director, Dr. Sam, who might be just the nicest person in the world. That's actually celebrating Kelsey, our program director. She was named the #1 program coordinator at Tower Health. So just an award ceremony for her. Top right, those are our brand new PGY2s after finishing their intern year. That's their first day over at the main hospital. And bottom right is just a picture of some of the residents over at our recent graduation that we had. So yeah. So with that, I think I'm right up against the time. If you guys have questions, Kelsey's email is right down there. You can also email me directly. My email is just my first name last name @towerhealth.org. My last name's kind of tough to spell, so you can look it up on the website. It's got 2 Z's in it. So yeah. You guys have any questions, you can pop them in the chat or feel free to just kind of voice them out.